Hello, good afternoon, everyone. My name is Dr. Viral Desai. I'm a practicing plastic surgeon. I've been practicing since 2003. My main field of interest is, of course, hair transplants and aesthetic surgery. Now, I have been doing hair loss treatments and hair transplants since 2003, so it's been over 17 years now. I would like to share some of my insights, and of course, I would like to take a lot of questions. Let me know what are your doubts and how I can help you out. Now, let me start with a quote. Hillary Clinton did mention hair matters. Hair is important. Hair matters. Take care of your hair as everyone else is looking at it. And that's so true because in a study which is done, hair does not have a lot of functional importance or value, but it has a lot of psychological importance. If a young person losing hair is very psychologically disturbed, and this was proved by a global study done, one third of the people who lost their hair said that they would let go of a very valuable belonging if they could get their hair back. So all this says that hair matters. Hair is the only crown that you'll permanently wear throughout your life. So keep it on. Now, basically, the hair grows at around half an inch per month. We have around 1 lakh hair on a head. Each strand of hair can support up to 100 grams. Now, if we combine all the hair that we have on our head, it can support the weight of 1.5 to 2 elephants. So that is what it is. Hair, if we go to see, is it's also there in the fetal life. Around the ninth week in the fetus, hair growth just does start in the eyebrows, in the upper lip, and in the chin. After the fourth month, the fetus has hair all over called lanugo hair, which is mainly non-pigmented, unmodulated hair. This hair will fall off and it will be replaced by the terminal and vellus hair. So this is how hair is. Now, when a newborn is there, he's got maximum hair density. The hair density remains maximum in the scalp, but it reduces in the rest of the body. Evolution of hair can go back. Hair has been traced in Mongolia as it's in fossils. It has come out through fossils, through casts, and hair has been traced in Mongolia. So hair is very important. And I would like to take any questions if you guys have any questions or any doubts about how to do hair care. These are difficult times where everybody is under lockdown. There is a pandemic, of course, especially in Mumbai and Maharashtra. The situation is even worse, especially where I stay, it's even worse. No one can get out. So, of course, we don't have access to, hair care experts easily or parlors. So, what you do is important at home. So, anybody, any doubt that you have about your hair care, please tell me about it. Now, please ask me questions about it. Okay, I'm going to wait for questions, but meanwhile, let me just tell you some more insights about general daily hair care. One of the question is how often do you actually need to wash your hair? That is a very, very common question which is asked. How often do you need to wash? So the answer is it depends on how oily your hair gets or how dry it is, or basically it depends on it whether it's straight, it's curly. It also depends on age. If you have a very oily scalp, you may need to wash it more frequently, maybe every alternate day or even maybe every day if it's very oily. If you have very dry hair, you have damaged hair, brittle hair, you've been using a lot of products, in that case, you should not wash it too often. You should wash it maybe once or at the most twice in a week. In such cases, you may need to condition your hair also. Uh, as you age, the sebum reduces, so there's less oil secretion. So you do not need to wash your hair too often. Too much of washing, too much of shampooing can actually dry up your scalp. Will Oil is essential, sebum is essential for the hair, so do not wash it too often, if and do not remove too much of sebum. Now, second question, what kind of shampoos, what kind of conditioners should we ideally use? This is a very, very common question. Everybody is confused about it and everybody is using various formulas, trying out various things. Let's understand this, that basically hair has is acidic. It's got a pH of around 3.67, so it's acidic. The scalp again is acidic. It's got a pH of 5.5. So whatever shampoo you use, try and make it as acidic. If it's Between 3.5 to 5.5 to 6, it's good and it's safe for your hair. If it is very alkaline, a lot of the parlors use very strong alkaline shampoos to give a rinsing effect, foaming effect, or cleaning effect. The more alkaline it is, the more problems it can create in the hair. It can cause more damage, loss of moisture, brittleness. The hair can get frizzy, brittle, it can break, split ends, and all these factors. And hence, a lot of finally will lead to a lot of hair fall. So, use shampoos which are mainly in the pH range of 3.5 to 5.5. Second important question, of course, conditioners. Do everybody need conditioners? Excess of conditioning can actually uh, clog and cause more oiliness. So if you have use conditioners only if you have dry, brittle hair. Otherwise, you do not need. Standalone conditioners are better than shampoo and conditioner two in ones. Try to use conditioners again, which maintains a pH between 3.5 to 5.5. If your shampoo has it's more alkaline or a pH of more than 6, definitely use a conditioner which has a pH of it's more acidic. So that is important. Now, what is basically a shampoo? It is nothing but a detergent. A shampoo is a detergent with which you actually wash your hair. It has got a primary surfactant. The primary surfactant role is basically to rinse your hair and to clean it and foam it or lather. Second is it got secondary surfactants which help to maintain the shine of the hair or the general health. Of course, it has got preservatives, it has got aesthetic agents like fragrances and coloring agents, and it's got functional agents like antifungals or some vitamins, etc., whatever we use. So, this is what it's made of a shampoo. Now, your conditioner, what you choose, depends upon what kind of shampoo you're using. If you're using a shampoo which is more alkaline, like I mentioned, always use a conditioner which is more acidic. So it will maintain the balance and it will help to restore the acidity back. Second thing is, as you're aging, wash less day by day because the sebum automatically reduces. Other condition is how many times a day should you comb? Should you comb your hair too frequently? How many times a day should you comb it? Interesting question. So a lot of people say that you need to give 100 strokes. That's not true. Until you detangle your hair, that's the amount of combing that you require. So the moment you detangle your hair, you're satisfied with it. You stop combing. What kind of brush should we use? If you use a plastic brush, you can get a positive charge in your hair, which takes the fibers because two positive hair fibers will repel each other, so it will stand or it will give a electric standing effect or electric charge to the hair or static, what we a lot of us experience. So you can use something like a wooden comb. A wooden comb is good, but a wooden comb may not have very flexible bristles. So in that case, you may use something, a plastic comb which has flexible bristles which can easily bend. The tips are not sharp. The tips are rounded or blunt, so they cause no mechanical trauma. And of course, it is wide mouth. So the wider the mouth, the safer it is. But it also depends on the kind of hair you have. So this is a very good. It's flexible. The bristles are flexible. It's broad. It's wide mouth. So this will not cause damage. But if you have a lot of tangling, then this comb may not work. Combs such as these are not good. They are not so flexible. They are very close. They can if there's a lot of tangling, it will cause a lot of damage to the hair. Second thing, it is sharp, so it will cause a lot of mechanical trauma. So try to use combs. If you have a lot of static, like I said, use a wooden comb. If you do not have much of static, flexible plastic combs, wide mouth with rounded bristles, flexible, those are very good. Something like this. And make sure that you comb your hair at least, I mean, to you wash your comb at least once a week or once in 10 days or 14 days. So that is important. The other question is, what are the home care remedies that one can take? Now, home care remedies, what you do, it depends on the kind of hair you have. If you have a lot of dandruff, you can use curd along with lemon juice. So the acidity of the lemon juice will actually help to break down the dandruff. Dandruff is caused by a fungus, and it's now the new studies say it's caused by bacterium, a staphylococcus. So it's important that you use acidic medium. Curds will give enzymes Curds will give moisture to the hair. Curds will also give certain certain minerals like calcium and like magnesium and zinc. So that's what the role of curds and uh, lemon is. So you can take curds, put lemon in it, apply it for 20 to 30 minutes if you have a lot of dandruff. It will also give a little bit of moisturizing. Now, if you have very dry hair, you can use curd or you can use a little bit of oil. Coconut oil is preferred. Olive oil is very thick, so it will make your hair very heavy. Coconut oil is preferred. Moroccan oil is preferred. You can add a little bit of honey to it. Honey will contain a moisturizing agent, humectant. It will help to give moisturizer to it. So this is how it helps. If you have a lot of oily scalp, apple cider vinegar will help. So take a bowl, take a tumbler, put 2 to 3 caps of apple or teaspoons of apple cider vinegar. Do not use it concentrated. It is acidic. Like I said, the pH of hair is 3.67. The pH of scalp is 5.5. So it will make it acidic. It will rinse the hair. It will remove all the debris. It will help. It will be non-irritant to the scalp. If there's irritation in the scalp, it will help. If there is frizziness in the hair, it will straighten it off. Uh, as time goes, the outer cuticle gets damaged. If you use a lot of products, if too much of moisture, too much of steam, too much of blow drying, too much of mechanical trauma, if you use a lot of alkaline medium, if you use dyes, chemicals, gels, straighteners, all these solutions which are used commonly, uh, so all these things, if we are using, it will cause a damage to the hair, which will lead to loss of moisture from the cortex. So to restore it back, you must use moisturizing agents for the hair. Conditioners will help. Take the pH back to acidic. The alkaline pH will open up the fibers and hence there will be escape of moisture and drying of hair. Dry hair will become brittle, it will fall, it will break. If you use an acidic medium, the strands come together, they close again, the hair shrinks, and it will retain the moisture. So use more of acidic shampoos, acidic conditioners, products. So that's what the role of apple cider vinegar can be. Of course, egg yolk can help. It helps in moisturizing. So egg yolk is very useful as a home care remedy. Now, what about coloring? Coloring in general is a chemical. Any chemical will lead to some amount of damage. But as of today, we do not have any good treatment for gray hair. So there is no option but to color it if you don't like your white or gray hair. So in coloring, there are various things available. Vegetable dyes. You have inorganic salts. You have organic products, synthetic products, which are more popular now. Vegetable dyes, of course, henna. We are all aware about. Most of the women have used it, but it gives the oranges hue to it. Now it's mainly found in Africa and in Middle East. So that's where the plant for henna is found. The compound is lawsum. That is what the compound is present, which is used. Now, the second thing is, of course, the inorganic, the metallic colors. They're not used anymore. They are very, very harmful. They cause a lot of brittle hair. Thirdly, what is used is, of course, the synthetic organic dyes, which are temporary, semi-permanent, and permanent. The permanent ones can be harmful. They need hydrogen peroxide as a reaction to release the molecules. The smaller the particles, they penetrate through the hair and they give color. Don't try to wash off the color. Let it go off by itself. These typically give color for anything between 4 to 10 weeks, or maybe in 12 weeks, depending upon how long it takes for the hair to grow out, and you gradually lose the color. So these are very, very popular. Now, what about straightening? What about perming, etc.? Now, perming is done in 3 processes. One process, the first thing is to soften the hair. Like I mentioned before, steam can be used, heat can be used, excess of moisture can be used to soften the hair. Also, a lot of chemicals, mainly ammonia, etc., are used to soften the hair. They are harmful to the hair. The more the chemicals, the more the harm. After softening it, you need to set it. So, curlers, permers, etc., are used. Do not leave them for too long, otherwise, they can cause a lot of breakage and damage. The third process is to set it. So you need oxygen for that. So now either through the atmosphere, let it dry by itself, or you use other things like sodium carbonate, etc., and that will help to set the hair. But I would like a word of caution: whatever procedures you do, do it infrequently, use less of it. Any chemicals, any dyes, anything excess of heat will harm the hair. A lot of people will face dry hair, they'll face frizzy hair, breakage, split ends, etc. Now, in that cases too, it's important to know that to prevent this frizziness, you need to retain the moisture. I've already told you the home care tips. Conditioners are very important. Uh, Besides that, you can also use egg yolk. These all products can be used, but be very careful when you're treating frizzy and dry hair. You can use a little bit of hair gel or hairspray, or you can use a little bit of moisture if you have a lot of frizziness. And finally, you just need to use apple cider vinegar. A bit of it, as I've told you before, will help out here. Should we take any questions now? Any questions? Now, another thing what I would like to mention here is there are a lot of hair clinics. There are a lot of hair clinics that are available there. There are a lot of doctors who practice hair. Whom should you go to? Which is the right doctor who can treat your hair? Now, basically, a doctor who learns about hair, he learns about it's there in his curriculum, is the one who's legally allowed to practice hair. Either a plastic surgeon or a dermatologist learns about hair, so he's allowed to practice regarding hair sciences. So be very careful, choose the right person, choose the right clinic. Do not go to a doctor who does perform treats or does not perform hair transplants regularly. A doctor who calls other doctors to do it, or he has another team to do it. Always go to somebody who is there legally valid to perform this hair transplant. Only a plastic surgeon or a dermatologist, in my opinion, can perform this hair transplant surgery, not any other specialty. MCI has clearly given guidelines that the most ideal people to perform hair transplant surgeries are plastic surgeons. These are big of the questions. Yeah, Sankhya, I can't see the questions on my screen. Can you just help me out with all the questions, whatever they are? So I'll answer them. I answered this question earlier. So Sunny's asked a question that he has thin hair. How often should he use shampoo? So Sunny, it depends. If you have very dry or brittle or damaged hair, in that case, you must use a shampoo. Don't use it maybe once or twice a week. But if you have very oily scalp, then you may need to shampoo it more often. In that case, you must use maybe alternate day. So that is what it is. Now you need to know how oily your scalp is. What you do is you wash your hair in the morning. You take a blotting paper or a tissue paper, leave it for 8 to 10 hours. Do not perform any excess of physical activities, just normal activities. You touch the tissue paper to your scalp. If it gets very wet, you have a oily scalp, you need to wash it more often. If it's moderate, you probably need to wash it twice a week. If it is very very dry, maybe once a week. So I hope that answers your question. What about the next question? Any other question is coming up? So, of course, single-use conditioners are, I mean, just pure conditioners are better than using a two-in-one with a shampoo. So conditioner depends upon what is the nature or what is the need of your hair. If your hair is very dry or brittle, you definitely need a conditioner. If it's very, very dry, you need an intense conditioning. What you need is need to put in the conditioner, put a cap for 10 minutes and leave it. However, if you have a fairly oily scalp but dry ends, split ends, you need to apply the conditioner only to your to the ends, to the terminal part of your hair, but not to the entire scalp. So always use a conditioner which has a pH between 3.5 to 5.5, like I mentioned before, because hair has a pH of 3.67 and scalp has a pH of 5.5. So I hope that answers your question. What is the next question? Well, somebody asked about a particular brand of a shampoo and a conditioner. Let me mention here that if I go into brands, there are going to be many, many brands. There are more than thousands of brands available in the market. It won't be possible to cover it here. But generally, go by the guidelines, go by something which has less chemicals, go by something which what you need. So if you need a conditioner or shampoo suiting your hair needs, if it's something which if you have some very dry brittle hair, you need a buttery kind of a shampoo or conditioner. If you have very oily scalp, you need something which is milder. So understand this. There's another myth that all baby shampoos are very, very good for the hair and they are safest. Yeah, in a way, it's true. They have the least chemicals. But baby shampoos, because they have to be tear free, they should not call tears in the eyes. Their pH is normally more than 5.5 to 6. So they are a little more alkaline. They can cause a little more damage and they can be irritant to the scalp because the scalp pH is 5.5. So if you're using a baby shampoo, always use a conditioner which is more acidic. Yeah, next question. There is no treatment available for white hair as of today. Unfortunately, we don't today have, but there are certain like calcium tablets, etc., which are arguably can delay white hair. There is a lot of there's no consensus among doctors regarding this, but in general, the treatment is not very successful. You can't do much. If you have white hair, you need to color them or dye them if you're not happy with them. Yeah. Next. This is regarding hair care or okay. Now if it's regarding your hair, you need a good shampoo and conditioner, what I've already described in detail, which suits your hair type. That is important. If you have a lot of hair fall, minoxidil 5% is the gold standard today. You need multivitamins which are suitable for hair. There are a lot of them available in the market today, which you should take on a daily basis. The other thing what you need is maybe a peptide solution, or you have minoxidil with finasteride topical application, which is very, very effective. And if you still have a lot of hair fall, then you probably can go for tablet oral finasteride, which is helpful for resting or reducing hair fall tremendously. Next question. So now, of course, hair fall is multi-centric. It has got various causes, genetic being the most important. Apart from that, poor hygiene, poor diet, stress, irregular hours, irregular sleeping pattern, irregular eating pattern, all these factors can lead or increase hair fall. So we need to reverse all of them. We need to live what is called as a healthy balance, uh, basically a balanced healthy life and a diet, which is very important. Now calcium, magnesium, zinc, these are very important. Vitamin B6, B12, they are again very important. Biotin is important for hair. So all this need to be supplemented. You need to have enough of proteins. That is very important again for good hair. You must take enough proteins on a daily basis. So not one particular food, I don't want to name it, but a generally balanced healthy food. I would suggest visit your dietitian, visit a hair specialist, and get more information on this. But sleep well, eat on time, rest well, exercise regularly, drink a lot of water, moisturize. Uh, these all things are very important. Clean your hair at the right time. Treat dandruff whenever it comes. Whenever there's dandruff, treat it immediately. Keep good hygiene. These are the factors that are very important. Yes, yes, yeah. Okay. So basically, the question was regarding dandruff. Okay, if I have a lot of dandruff, how do I treat it? Now, basically, what is dandruff? It is actually there's a lot of it's increased turnover of the cells. The cells normally the turnover is 3 to 4 weeks, but if the turnover increases, then there's a possibility of dandruff and also drying. So drying in winter increases the dandruff. These are basically the top dead cells, the corneocytes which are there. If you have oiliness, they will clump it together and make it worse. Also, bacteria known to cause, and it's genetically predisposed. It is in your genetics. Now, earlier it was supposed to be only a fungal, Milliformis furfura, but today we know that there's also bacteria which can cause dandruff. So, what you need to do if you have long hair and a lot of dandruff, you need to use anti-dandruff shampoos. You need to use, you like Nizoral, etc. Whatever shampoos are available. You may use it once a week, twice a week, depending upon the severity. Antifungal ketoconazole, basically you need to use. Zinc pyridine is another substance. Check out whatever the shampoos which contain these two. Then the other thing what you can do is home remedies like curd and lemon, like I just mentioned, that will help. The curd has enzymes, the lemon will help to break down. It's acidic, and that's how it will help the dandruff. So take care of your dandruff, get rid of it. If you have a lot of long hair and you have a lot of scaling of dandruff, it can cause reaction on the face. Sometimes if there is on the face reaction, it could be a severe form seborrheic dermatitis. In that case, again, you need the same treatment. Sometimes you need coal tar or salicylic acid. What it does, it basically removes the dead cells and it reduces the turnover or the continuous death of cells. It reduces that, so that's how it helps. Yeah. Any other question? Hair oil, again, it depends upon how dry or how moist or how oily your scalp is or how oily your hair gets. If you have naturally oily scalp and oily, if your hair gets very oily, like what I have in my case, you may not need to use hair oil. Now, the oil by itself, what the role is, it basically helps to retain the moisture. So if you have very dry brittle, you can use a oil. You can use it if it's not very dry brittle. You can use it just an hour before shampooing or cleaning. Or if it's very dry, you may leave it overnight. Hair oil by itself will not promote any growth, but if you use little warm, lukewarm oil and the massaging, the warmth and the massaging will actually help increase the blood supply, and that's how it helps, and that's the benefit of it. Yeah. Next question. Yeah, certain studies have shown caffeine can be important, but it's still not a very established thing. So, without going much details, there are many other things which are far, far better. So, we can use those more medicinated stuff. Yes. Next question. Okay. So, coloring agents, they have chemicals in them. So, PPD and PPT, these are the two agents which can cause a lot of irritation. If you do get a lot of irritation with this, and of course hydrogen peroxide, if you do get a lot of irritation, you probably need to switch to other compounds like you need to use vegetable dyes like henna. That may be beneficial. Of course, color should be ammonia free. That is important. Ammonia can be very, very damaging to the hair. You have a lot of ammonia free colors. Try to, if you have a lot of allergy, try to use another brand, another compound, another substance like I mentioned. Always use a test patch. Use a test patch, keep it on. If there's a lot of reaction or there's some reaction, don't use that particular chemical or that particular brand. Try to switch over. Of course, if nothing else, use vegetable colors, nut, even walnut colors are available sometimes. Henna is there, of course, and walnut colors. So try to use them. Next question. My hair. So, like I said before, there's not much of treatment available, and there's no established treatment for graying of or premature graying. The only best thing what you can do for premature graying is you need to color the hair or dye it, or you need to be just make your peace with it, because not much can really help there, unfortunately. Yeah. Next question. Use something which is not very heavy. Olive oil, etc., is very heavy. Use something, coconut oil, that way is lighter. It won't make the hair very light. The same Moroccan oil is there. So these are more oils which are suggested as compared to very heavy oils. Yeah. Yeah, so that's a very interesting question. Oily at the roots and dry at the ends. So of course, you need to use a leave-on conditioner, or you need to condition the hair, the terminal part or the ends of the hair, not the scalp. Now, excess of conditioning on the scalp can actually cause clogging of the sebaceous glands, and it can be harmful. So you need to use, something which can leave on conditioners to the end of the hair and not on the roots. That is how the solution will be for this. Next. So frizziness has a lot of reasons. Of course, it's related to the atmosphere. It gets frizzy with dryness also. If there is lack of moisture at the terminal part, if there's breakage of the cuticle, then it gets frizzy. If the moisture is lost, it gets frizzy. The other thing is, if you're combing with a plastic comb, and if there's positive charge in the hair, now two positive hair strands will go apart. They'll stand up and they will repel each other. So it will cause standing or frizziness or electrically charged hair. So now what you do is, of course, conditioning, retain the moisture, get back the moisture, use oil to the roots, to the ends, use a lemon conditioner, use an ionic blow dryer, because that will help to get the pH down, the charge back to negative. The charge comes back to negative again, it will get better. So these are all the remedies that can be used for excess. Now, ultimately, if it's too much frizzy, if it's too long hair, you probably need to go for a haircut. Yeah. Next question. Natural way is, there are a lot of things. Healthy, balanced lifestyle. Eat right. Eat at the right times. Eat the right quantities. Rest well. Sleep well. All these factors. Exercise daily. All these factors will help to help the hair. Of course, take adequate nutrition. Take enough of vitamins, minerals, essential minerals. Take a lot of proteins. So these factors will help. Of course, if you still have a lot of hair fall, you need to visit a specialist and get it examined. We need to do certain blood tests if required. We need to do a trichoscopic analysis of the scalp, and we need to know, stress can be a factor for temporary hair fall. If it persists, it could lead to chronic telogen effluvium. So that is again harmful. So these are basic good healthy balanced lifestyle and diet is what is required for hair. Next. Well, split ends, I've answered this before, but I'll say it again. Split ends is basically loss of moisture, drying, all these factors. And of course, the positive charge which can occur, all this will lead to it. So, whatever remedies, get back the moisture, okay? Use hair oil to the ends, use leave on conditioners, use conditioning to the end of the roots, to the end of the part rather than the scalp. Nutrition, enough good vitamins, minerals, which are required, as I mentioned, zinc, magnesium, calcium. vitamin B12, B6, other vitamins, vitamin D. All these are required, which will give nourishment to the roots, and hence the hair will be healthier. Finally, if you're not able to get rid of split ends, you need to trim the hair, especially at the ends. So that is what is required. So that also, let me answer, how often do you need to cut your hair? That will depend upon whether you have short hair, long hair, and how fast your hair does grow out and what you desire. Now, if you want to grow your hair, you probably need to go for a haircut once in 2 3 months just to get rid of the terminal part which is not so healthy, or the split ends, or the dry part, or the frizzy part. But otherwise, if you need to maintain short hair, you probably need to go once in 3 weeks or 4 weeks. Yeah. Next, nice loose. I didn't get the question. What was the question exactly? So, I think the question is about curling. What do I do if I want to go for excess of curling or something? So, like I mentioned earlier, this involves a lot. It involves three processes, right? From breaking of I mean, loosening the hair, to curling, and finally to set it. All these can be harmful, so be careful. Do not use excess of curlers. Do not use excess of products. If you have to do it once in a while. Make sure you do it at the right place. Make sure you use the right components. Do not use it for more than 20 minutes. Otherwise, it can cause a lot of damage and break to the hair. Next. Okay. Now, I think we are done with the questions. Any more questions? Anything else? I'm sorry, I can't read the questions on the. Yeah, any more questions or. Okay. So, should we end it then? Yeah. Okay. Okay. So, thank you everybody for watching this live video about hair care. I hope I could answer most of your questions and doubts. Uh, However, if you have any more doubts, please visit an expert. Check the degrees, check the registration, check what kind of a doctor are you going to, what kind of a clinic are you going to. Are you seen by a doctor? Are you seen by marketing people? How much has your doctor studied? What is his degrees? Is he qualified to perform hair loss and hair transplant treatments? It's very, very important. Choose the right place, and please take care of yourselves. Stay safe. And I have given you some home remedies for oily and dry scalp, and even for itchy scalp or dandruff. You can use them if you don't have access. You can use a little bit of curds and lime if you have a lot of itching and dandruff. If you can use apple cider vinegar diluted with water if you have a lot of oiliness. If you want moisturizing egg yolk, of course, again, curds and honey. Honey helps a lot. So this can be with humectant, it's available. So you can use this at home. Care. And thank you so much for watching me. Thank you.